Good evening, all. Dear attendees, in today's webinar, Doctor will be shedding more light on AVN and its treatment with the help of bone cell therapy. Joining us will be a senior AVN specialist, Dr. KJ Reddy, sir, who has 30 plus years of experience in the field of orthopedic as a consultant surgeon. He is associated with Apollo Hospital, Hyderabad. He has operated on a number of patients who has been suffering from AVN and saving them from total hip replacement. Over to you, sir.
Good afternoon. It's a pleasure having a discussion and meeting with you. As you know, AVN is growing up significantly recent years. Can I have my slideshow when I'm talking?
Yes, sir.
Um, Previously, just for example, I used to see maybe 3, 4 in a week, but presently the number has increased so much. Every day I see about 6, 7 and operate about 2, 3 every day. And the reason being the COVID. COVID brought us this major problem because of the COVID itself and steroids using to treat the COVID. Previously, the common cause was alcoholism, steroids, blood diseases, and um, to some extent other smoking, other conditions. But now COVID becoming the major cause for avian, COVID disease itself, and treatment which we use, especially in second wave, first wave, second wave, lot of steroids were used. Next slide. Can you follow that? Yes. Avian, as you can see, um, the basic problem in avian is depth of femoral head, as you can see here in the hip joint, which will lead to weakness, collapse of the bone, and leads to arthritis, which will cause severe pain in the groin, limping, and unable to do day-to-day activities. Next one. As you can see here, this is the normal hip, the ball of the hip joint, where it's spherical. That means it's very round. The avian affected ball of the hip joint will be flattened, disrupted, and it's irregular, which will lead into arthritis of the hip joint. Next one. And as I mentioned, commonest cause being corticosteroids, alcohol, idiopathic, sickle cell, SLE, and of course, COVID itself. Next one. Trauma can also cause AVN because following dislocation of the hip joint or fracture of the hip joint can lead to AVN. So the common symptom is pain in the groin, mainly in the groin, buttocks, sometimes radiates to the thigh and the knee. And it can be initially pain and activity. People won't be able to sit cross-legged, won't be able to sit on the floor, won't be able to go up and down stairs. And later on, this pain can be at rest and night pain disturbing the sleep. And there will be loss of mobility stiffness. And sometimes there may be shortening of the leg length. Next one. As you can see, the initial stages are difficult to diagnose with X-rays because X-ray looks quite normal. So I keep warning my patients or patient attenders, whenever you have a history of COVID or history of steroids taking, and get pain in the hip joint, especially in the groin, if X-ray is normal, do not neglect it. You must get an MRI done because if this groin pain is prolonged, it could be due to avian. And there's so many classifications are that. Basically, the classification which we use, next one, which we use ARCO classification, which divides into stage 1 to stage 4, um, where stage 1 to the head is spherical, whereas stage 3 and 4 there will be collapse. Stage 4 the arthritis. Okay, next one. And the duration, how far the progress from stage 1 to stage 4 is variable. Sometimes it can be very few weeks, or it can be few months or years. Very unpredictable. It varies from patient to patient. Next one. Um, so in the initial days, we used to do simple core decompression. That is, as you can see here, just make a hole in the middle of the head and decompress the head. As we used to think that the pressure within the hip joint is more within the head, we used to do a core decompression routinely, but most of this core decompression progressed and resulted in osteoarthritis. So nowadays we do not um, do simple core decompression. And as you can see, there are no effective medication for this condition. So many medicines have been described and prescribed, but none of them are very effective. Still, we use bisphosphonates in addition to surgical procedures. So once any of these procedures fail, they progress to arthritis. And if severe arthritis in olden days, previously, the only rescue was doing a total hip replacement. The disadvantage of total hip replacement being most of these patients are young. So if you do total hip replacement at the age of 20 to 30, um, they need maybe 2 to 3 surgeries later on. That's why we want to save the head. Next one. So preservation of the hip is very, very important, as I said, because most of these are young people. If we do replacement at early stage, it will need revision, because if we do at the age of 20 or 30, it will last maybe 20 years. The hip replacement ideally designed for the people who are about 50 to 60, which might last their lifetime. Next one. What happens is there are um, various procedures have been described, but the most successful one is OSSGROW. Next one. OSSGROW, that means what happens is we preserve the hip by treating with stem cell treatment. Because these are uh, young patients, so preservation of the hip is more important. Next one. OSSGROW means bone cell therapy. What we do is we take bone marrow from the pelvis, send it for the lab, grow stem cells. Once they're about 4 million cells, we bring it back to the patient, and we do this surgical procedure where it combines similar to core decompression. That means we make a little hole in the head, take the dead bone out, and inject um, lab grown stem cells, which are actually osteoblasts. So this has very effective, and we know the cells we are injecting are alive and they're going to be effective. So this is called bone cell therapy or OSSGROW. Next one. And the mechanism action is what happened is osteoblasts, they form the new bone, and they will replace the dead bone and make the hip joint probably back to normal. That's our expectations. And most of the time, what happens is um, probably it is very effective in preventing further progression of the disease. And to some extent, it will might help in repairing the dead bone. Next one. So during the treatment, you should not smoke, drink. You should maintain weight, no impact activities. You have to protect the hip joint from severe physical activity. So otherwise, the stem cells will get damaged. Next one. So first 12 weeks, you can see these exercises. First 6 weeks, it should be non-weight bearing exercises. After 6 weeks, we should slowly increasing weight bear. And swimming is excellent exercise as well as cycling. Next one. Okay, next one. I told you this one. So this OSSGROW stem cell treatment prevents uh, uh, collapse of the head and prevents arthritis. So it eliminates the need for total hip replacement. If it is successful, you can have a normal hip for the rest of your life. So repeated, once it is successful, it need not be repeated. And it's approved by Ministry of India, backed by clinical trials. Next one. And you can see so many publications supporting this um, study, these treatment. Next one. So these are, you can see, these are the telephone numbers where you can reach for help and you can detail information. And on the website also you find the information whom to approach, when to approach, what are the advantages, disadvantages. Everything will be explained to you and you will get good counseling. Next one. So this is the most important numbers. You can note it down. And this is also website. You can reach and the detailed information will be there. Um, so most of the most important uh, um, of this treatment is, as you know, if you do not treat this condition, it will invariably go to arthritis, which will need replacement. As most of these patients are young, replacement at the stage may not be advisable, might need second or third operation. So if it is effective, it would prevent the um, need for replacement. We say if we do symptomatic patients in stage 2A, the success rate is about 80%. Even some selected cases we can do in stage 3 as well. But in stage 4, where there is a collapse, arthritis, this procedure is not recommended. If you have any questions, please kindly put in the chat box, or you can later on also you can inquire at the head office. I would be more than happy to answer your questions.
Sir, we will take few questions.
Sure.
The first question is, how is the success of this treatment?
Yeah, just I told you, if it is diagnosed in stage 1, 2, if it is stage 1 asymptomatic, we do not treat them. If it is stage 1 symptomatic, stage 2AB, success rate is about 80%. That means there is 80, if you do 100 hips, 80 hips will survive. 20 hips, probably, they may not completely survive, but at least it will prolong the need for replacement. In about stage 3, we say 60 to 70%, depending upon the area, location of the involvement. Yeah.
The next question is, can one do all the activities after treatment and rehabilitation?
Yeah, the rehabilitation is very, very important. For 6 weeks, you have to protected weight bearing. After 6 weeks, up to 3 months, you have to be careful, no heavy physical activities. But after 3 months, you can start doing most of the activities, including driving, going to work, and cycling, most of these activities. But 6 months to 1 year, maybe 18 months, you should not do impact activities. But once it is completely back to normal, it might take 18 months to 2 years, because it has been shown these cells are active in the head up to 2 years. So if it is successful, after 2 years, you can be back to normal activities, including any kind of sports.
Okay. And the next question is it covered under insurance?
Yes, it is covered in all the insurances. I mean, so insurance whichever covers your medical treatment, like hip replacement, knee replacement, this procedure also covered under insurance.
Okay. And will a patient requires a hip replacement later?
See, as I said, if it doesn't, if people come late, people do not. I mean, people do not. Of course, do not take treatment. If there is arthritis, then they need hip replacement. But in those who are successful, do not need hip replacement.
Okay, sir, would like to know the difference between PMAC versus OSSGROW.
Yeah, I so told in the beginning. The initial, rather we say, initial treatment was only core decompression without doing anything. Sometimes we used to do fibular graft. Later, second stage, rather, second form of treatment with second generation treatment was core decompression. BMAC means we take the bone marrow aspirate from the pelvis, concentrate, and inject into the head. The disadvantage being we do not know how many cells are active, and most of the time it's a liquid, so it will come out. So it's not very successful. This is we call third generation or latest one, where we grow the cells and make sure all the cells are active and viable. They are live. And we put in a matrix, a fibrin glue, so that they stay within the head. Yes. Any more questions?
Okay. So the ones who are interested to have web consultation with Dr. KJ Reddy can connect with us. We have dropped the number to connect in the chat section of this platform. So anyone who are interested, please do contact us. We can arrange a web consultation with sir directly.
Thank
Thank you
you.
so much, sir. We would
Thank
end
you.
this now. Yeah. Thank you so much.
Thank you. Thank you very much.